Left in limbo, thousands of local patients are finding their healthcare providers are now out of network. This comes after UF Health, an insurance company, United Healthcare, failed to reach a contract agreement by their September 1st deadline. This impacts UF hospitals and physicians groups in Jacksonville, St. Johns County, and also Gainesville. News 4 Jax reporter Ann Maxwell spoke with some patients on how they're being impacted.
As UF Health and United Healthcare point fingers at each other for failed negotiations, patients like Michelle Chester's grandchildren are left in limbo.
The provider that they go to, we love them, obviously, or we wouldn't try to be fighting this hard to try to stay where we're at.
She says her 17-month-old granddaughter was in the hospital with a persistent fever when she learned a follow-up appointment scheduled in September would be canceled.
At that point, it's a panic. We got a kid in the hospital who is needing to follow up with a specialist.
In a statement, United Healthcare said UF Health's last proposal included a 30% price hike over 2 years and a more than 20% rate increase in 1 year, which is not affordable for consumers or employers. While we remain committed to continued discussions, our focus now is ensuring Florida families have access to the care they need through continuity of care or a smooth transition to another provider as appropriate. UF Health's statement said, UF Health has been striving to fulfill its mission of caring for patients and the communities it serves while managing continual double-digit increases in labor supply and other expenses. However, United offered UF Health commercial rates that are below general inflation and far below rising annual costs. They also said United has also refused to honor their commitment to pay rates previously agreed to. Complex and lengthy prior authorization processes, complicated billing and coding requirements, and claim denials and payment delays have led to reductions in reimbursement to UF Health. This results in payments that are significantly less than other managed Medicaid payers.
That's what I felt like. You don't care.
Chester says United has denied claims for her granddaughter's emergency room stay and for her grandson's appointments, all of which she says were directed by their providers.
And you're saying that it's not medically necessary and you're having to fight. They're having to constantly fight this battle to get things paid for. I wouldn't want to deal with you either.
UF Health is a nonprofit. They say the revenues generated are reinvested back into the healthcare system. Meanwhile, United Health Group made about $22 billion in profit last year, with the CEO receiving in compensation more than $23 million.
You're getting a nice hefty paycheck while the rest of us around here scrambling for care.
Ann Maxwell, Channel 4, the local station.
United says its members will continue to have access to other providers in Northeast Florida, and some patients in the middle of treatment at UF Health may be able to receive continued in-network benefits. We posted information on both options. Just scan this QR code to take you to this story on news4jax.com. Now, this decision comes as Baptist Health and Florida Blue are at odds over an agreement for patients who have the insurance to remain in network at Baptist facilities. Their deadline to come to an agreement is September 30th, and the groups have 3 meetings scheduled this month.